Hello, everyone, and welcome to our Friday edition of Facebook Live here at Henry Mayo Newhall Hospital. My name is Bud Lawrence. I'm an emergency room physician, and I am the medical director of the emergency department here at Henry Mayo. So today, as you can see, I'm by myself, so you're stuck with me for the Facebook Live, but hopefully we'll be able to give you some good information. So really today, I'm going to try and hit on some talking points that might be valuable for you as viewers in our community to understand more about COVID-19, different terms, what these other weird words mean that you always hear thrown around, things like intubation and extubation. So hopefully this will provide a little more clarity as we move through this journey of COVID-19. A real quick update, you may have noticed, people always are asking about data and numbers, so you may have noticed the upslope in cases in Southern California, in Santa Clarita, and in California in general. I've said this before. I've kind of mentioned to be cautious about that data when it comes out, because what's happening really is that we are testing more people. So we know more people are actually positive, and those positives count in those numbers. So you're going to see an increase in overall cases of COVID-19, but a lot of that's going to be attributed to the fact that we have now more widely available testing. So as many of you probably know, that there is a drive-through testing site at College of the Canyons, which I should say was initially set just for patients with COVID-19 symptoms, but now they've opened it up to patients who are essential workers. So things like if you work in a supermarket, or if you work in the healthcare industry, if you're a healthcare professional, or an essential government employee, or a first responder, those kinds of people, I believe, meet the criteria to sign up for a test to get your COVID-19 test. It's something that may or may not be helpful to you if you have no symptoms, but it may be good to know that you don't have it if you're working in an essential business or an essential function to our society. So I would expect the numbers of COVID positive patients to go up as we test a greater number of people in our population. So that really makes sense to me, and that fits. As far as Henry Mayo goes, one, I think, very cool statistic is that we've actually discharged from the hospital more COVID-19 patients. That's 33. We have discharged 33 patients as of right now from Henry Mayo, and we only have 23 patients in the hospital that actually have COVID-19. So we've discharged more patients than we are actually taking care of currently, which is really cool. And that doesn't even count the patients that are just kind of convalescing, getting better on their own at home. So that to me is a good sign. We have currently 7 ventilated patients in the intensive care COVID unit. 5 ventilated patients with 7 patients total in our intensive care unit. So really only 5 ventilated patients. That's not a big number. We're certainly not seeing a big surge that was predicted. I think, I'm cautiously optimistic, but we're, based on all the mathematical modeling, we kind of should be hitting the very, very, very end of that window for a surge. I think a lot of this depends on the great job you guys have all been doing at staying at home and assisting us to get through this with the least impact on our healthcare industry so that we're not overwhelmed. And I think that says a lot, too, to how our patients have done very well and have been discharged from the hospital, many of them, because we're able to apply the right resources. We're able to really focus on them and make sure they get better. So those are some usual kind of data points I think people kind of like to hear. Let's move on to some medical terminology. So I think many of you know that when you see a doctor or you hear doctors talk, we talk in some weird language. Some lawyers also talk in a weird language that's hard to understand. So I just kind of want to break down a few things for you guys so you can understand what people are talking about, either when you're talking to a physician or maybe you hear this on the news and you may not have a good understanding of exactly what these terms mean. So PPE, I think you heard this all over the place, and PPE is personal protective equipment or personal protection equipment, and that equipment is what we use to keep ourselves safe, and in terms of masks, what people in the community are now using to keep themselves safe. Now, it's important to understand with PPE, there are different levels of PPE. So if you're taking care of somebody who has COVID-19 that's been diagnosed and is having a procedure done like a nebulizer or something else that's causing an aerosol of that viral particles into the air, we have to be really careful with the PPE we use, and we use things that kind of go over our head called pappers or cappers, or we'll use a face shield and an N95 mask. Gowns are often used, gloves certainly, and sometimes you'll see people protecting their hair and their shoes. This is the highest level of PPE, and this is something that you'll see pictures of when you see the news and you see intensive care units or very sick COVID patients. But there are different kinds of masks, for example. So that N95 mask is a mask that we use when we are really in an environment that has a lot of viral particles floating around or on things, but there's also regular surgical masks that we use, which are also very effective. And then you can work your way all the way down to even using cloth masks or homemade masks, which many of the people in the community have been kind enough to make and wear. And so there are many different varying levels of personal protective equipment, and all these kind of go together to allow your healthcare providers to safely take care of COVID-19 patients. Another common thing I think you probably have been hearing about is intubation and extubation and ventilation. Those kind of all go together. I think there's been a lot of talk in the media about how people who are intubated tend to have perhaps a higher likelihood of not making it through their illness because they're so sick that they need to have a breathing tube placed. So intubation is exactly that. It's placing a breathing tube into your airway to help protect your airway, and also, in the case of COVID-19, make sure that you're getting the right amount of oxygen, not too much and not too little, and the right amount of pressure being delivered to your lungs. Because one of the problems is sometimes almost all patients with COVID-19 need a little bit more pressure to open up their lungs all the way so that they can oxygenate properly. So intubation is the act of actually putting that breathing tube down. Obviously, if it's done with medications, that if you ever needed to have this done, or a loved one, those medications are there to sedate the patient so it's not uncomfortable, and actually paralyze the patient so that everything is nice and calm and relaxed. And many of those medications are actually, the sedatives in particular, and pain medications are continued on when the patient is intubated and being what's called ventilated, which is where they're on a machine to help them breathe, to make sure that the patients are comfortable. That's a very important part about administering this care, is to make sure the patients are comfortable during this. And then, so ventilation is when you're actually attached to a machine that's breathing for you. And then extubation is a glorious thing generally, is when the tube comes out. It's a time where you've needed the tube has done its work, the ventilator, the machine has done its work, and now you're getting better to the point where we can take that tube out. So extubation is just the removal of the tube. So kind of a few complex words, but maybe that gives you a better understanding about intubation and extubation and what happens during that process. And yes, the numbers for mortality rates of people who are ventilated are somewhat, it's variable, but some places 60% or higher of those patients don't make it through their disease process. But remember, that's data that we're getting from all over the world, and many of these places like New York and Italy are truly overwhelmed with patients on ventilators. Here at Henry Mayo, our numbers are much better than that, and the reasoning is because we're really allowed to, we have the luxury, I would say, to focus on those patients and put all our resources into it to make sure that we're giving them the best possible chance of getting off that tube, being extubated. And fortunately, we've done a very good job with that here. So very important to know. Another word you might hear is something called proning. Proning is when patients get placed on their stomach. So prone position is when you're on your stomach. And COVID-19 is a very strange process with your lungs. But basically, when you lay on your stomach, or there's different variations of proning, you can lay on your either side as well, is helpful. It allows the lung to properly inflate and to allow you to get more oxygen into your system and allow you to ventilate better. So proning is something you might hear. Something else you might hear are with testing there's a test for positive and negative, which is the most common test out there, and there's a test for antibodies. The antibodies, the two that you'll hear are IgG and IgM. The IgG is the one that we would be looking at to see if you've conferred any immunity, or if you might be protected, or you've had the illness and now you might be protected from getting it again. So you hear that quite a bit. You'll hear about medications. I know you guys have heard these on the news quite a bit. Plaquenil or hydrochloroquine or chloroquine is another variation. Hydroxychloroquine, sorry. Azithromycin, which is basically an antibiotic. It's like the Z-Pak. You've probably heard of that. Actemra, which is an IL-6 inhibitor, a little bit more complicated, but may show some benefit in really, really sick patients. You've probably heard of remdesivir, which is a medication made by a company called Gilead, which has been shown to be somewhat promising in some of the data that we're getting back. Again, the jury's kind of out. I say this all the time. We don't have a lot of great data to go by, but we're using the data that's out there, the experiences people have had, to try to guide our best possible treatment of our patients. And every patient's different. Some patients respond to some medications and some don't. So you may have also heard with hydroxychloroquine in particular that some of the studies that have been done, some of the research, or at least NIH has said, the National Institutes of Health have said, maybe that's not the safest medicine to be taking if you're just taking it prophylactically. So I'd probably advise staying away from that. Another question that came up was clots in COVID-19. So what we are finding out is that definitely there is a likely what's called thromboembolic process that's going on. And that means basically little tiny clots that can form. Sometimes those clots can form in your legs or in your larger vessels. Oftentimes, though, they can be in little tiny vessels. We're seeing the tips of the fingers and toes sometimes being affected. So somebody asked about blood thinners in COVID-19 patients. Absolutely, that is something that we are using often on COVID-19 patients. We do feel that there is a benefit to that, but again, we're just learning from this, and we'll know a lot more once this is all done. Really quickly, I just wanted to bring up what Henry Mayo has done to prepare for COVID-19. I think we brought many of these points up before, but just to kind of bring it together for you. So we've started from the very beginning, very, very early, a drive-through testing site here. We have what's called external triage. So we meet our patients outside of the ER, and we sort of divert patients with respiratory type symptoms or fever into a big tent that we have, or we can even leave them in their car. We do bring other patients in. Again, our emergency department is open. We don't want you staying home with heart attacks, strokes, abdominal pain, other reasons you would have been concerned to come to the emergency room. You should still be coming to the emergency room. We can take care of you safely, and I don't want you to stay at home and get sick and have a bad outcome. As far as other things the hospital's done, we now have a universal masking policy for people that come in the hospital, and all of our patients are generally in masks, particularly in the emergency department. So cohorting patients, we have floors that are set aside specifically for suspected COVID-19 patients or positive COVID-19 patients. So we're segregating those patients to make sure not only they get the best care, but also that our other patients in the hospital are not being exposed to the virus. We're being very, very diligent about that. We've done a great job with PPE acquisition, and I should say that we are in a good position with PPE, but our community has been unbelievable, not only with donating food, which is a whole nother topic, it's just amazing, but with giving us PPE to really make sure that we have a good stock regardless of what happens in the next weeks, months that are coming up. So thankful for our community's assistance. We've done a great job with pharmacy supply chains. Remember, to take care of all these patients, we've got to get medications, and all these supply chains are really volatile. Sometimes you can't get them. You can't buy these medicines. We've got our pharmacists up at 5:30 in the morning trying to get us medications to make sure we can safely treat our patients here. An amazing job done by all the departments in the hospital, respiratory therapists on the front lines. We are so thankful for all their hard work. You should be thankful that this community hospital has really positioned itself so well to care for our patients in this time of need, which it really is it's a crazy, unprecedented, I don't want to say use the word crisis, but it's just an unprecedented situation. Couple other things just to mention. This weekend is going to be hot, and just non-COVID related, to take a break from that. Please be careful when you're out this weekend. We're all doing the stay-at-home thing, so we all want to get outside, particularly when the weather's nice, to do walk, jog, exercise. Just remember it's going to be so hot. Stay hydrated, particularly if you're elderly. Maybe don't go out this weekend. The usual heat precautions that we talk about during the summer months, this looks to be a pretty significant heat wave from what we've been experiencing, so please be careful with that. And then the last item I'd like to bring up is that Henry Mayo is being very diligent about reopening our service lines, in particular things like heart procedures and outpatient elective surgeries. So if you're someone who is waiting for your gallbladder to be done or a knee replacement, these kinds of things, we're hoping to ramp those things up very quickly. We've got a whole team working on that, and I'm very confident we'll get that up and running shortly. And most of all, we want to make sure that you are safe and healthy and well. Utilize us if you need us. We are here for you. The hospital is fully staffed and functional, and we want to thank you so much for staying at home and taking that sacrifice. I know we talk about all the time of the social sacrifice and the economic sacrifice for many of our community members. And just to let you know from our standpoint, We are so thankful for the work that you do. Very thankful to have you listen to me today, since I'm the only one here. I hope you all have a great and safe weekend. If you want, post some questions in the comment fields, and we'll try and get to them the next time around. Thank you so much for tuning in. I'm Bud Lawrence, and have a great, safe weekend. Take care.